Hello and welcome everyone to today's webinar on infection prevention and control with regard to the corona pandemic. I hope that you're all healthy and safe, and I saw that we have a lot of participants from many different countries today. So welcome to all of you wherever you are located. My name is Caroline Kräling. I am Policy Advisor on Humanitarian Assistance for FENRO, which is the German NGO umbrella organization. Before we start with the webinar, I would like to present our speakers and explain the structure of the webinar. With me today are Melina Margarita Wellem and Hendrik Kirchner. Hendrik is part of the First Assistance Samaritan team for ASB Germany, and he will give you an overview on infection prevention, some medical basics with a focus on COVID-19. Melina is head of ASB country offices Indonesia and Philippines, and she will give an insight into project adaptations that ASB has made in Indonesia due to COVID-19 and explain some corona preparedness and response mechanisms. After the inputs, we will have some short Q&A sessions. So if you have any questions for the speakers, please use the chat box that is located at the bottom of your webinar window. Your messages will be directly sent to me and I will read them out anonymously. The last part of the webinar will be a little bit more interactive. I would like to ask you to share your experiences and project adaptations or recommendations for other participants that you have made during this new situation for all of us. You can also use the chat box by sending in your messages. After the webinar, you will receive an email with today's presentation with a link to a survey and with all the collected feedbacks and comments from the participants. We will also record the webinar and provide the record on our website. You can rewatch the webinar if you would like to. I hope everything is clear for you. So I would like to start with the first input on an overview on infection prevention by Hendrik. Hendrik, over to you.
Okay, so also welcome from my side. Let's dive into it directly. So I want to talk briefly about the basics of IPC concerning the new coronavirus. And the first thing is we, in our EMT at the ASB, looking at this thing from a slightly different perspective. So if you start concerning yourselves with infectious diseases, the first thing that you recognize is that there are a lot of infectious diseases. And we tried to come up with a method to get a bit more structure into this, because here you just see a small number of these diseases that could be or are infectious, but we want to sort them in some kind of way that we can work. And the first criteria we try to make up is which mode of transmission these infectious diseases use. And there are generally 4 major modes of transmission. We have at first a contact transmission, so it needs direct contact to a person. We have a droplet transmission, which means basically somebody coughing or sneezing at you. And we have an airborne transmission. Then there's a 4th way of transmission, which is vector-borne, which means a disease transmitted via mosquitoes or ticks, for example. But these are not such a big concern for the IPC measures. They require special measures like vector control and something like this. That's why we don't include them. And generally, for a healthcare setting, they're not that important. Okay, so I would start first with talking about contact infection. So generally, it's every sort of contact with a person. Handshake is the most common way to contract the disease or touching contaminated objects or surfaces. So the majority of the infectious diseases we know make up contact infections. So it is a majority of diseases, but it's also the easiest way to get the chain of contraction interrupted, because we just need to prevent contact. So basically, if you have a person, for example, most diarrhea diseases are contracted via contact, and it basically means if you will have a sheet of paper between you and the other person, you would be safe. This would be the contact distance you need. So if we go on to droplet transmitted diseases, you see disease that's transmitted via droplets is far more potential in terms of its transmission, not in terms of severity. There are also contact transmitted diseases who are really severe. So it's only from the transmission point of view. So you have a distance up to 2 meters or 6 feet where you can transmit droplets. So looking at these droplets, so they are mostly produced via coughing or sneezing, or let's say that's where they get their really range, or their a bigger range. So you would all, to a certain amount, you produce even via speaking droplets, but they are really in a very short distance. So for an IPC perspective, coughing and sneezing, there things start to get interesting. So most of these droplets are usually contain saliva, dead cells and food residue, and of course viruses, bacteria, or other germs who could be or could cause an infection. And droplets also follow a ballistic trajectory. So this basically means you need to aim at somebody if you want to affect via droplet. So I need to directly stand in front of a person and cough at them. So then I have my trajectory of my droplets and I can infect the person. So these are things to consider if we want to take precautions about. So it's not meaning if I would stand with my back facing you and start coughing, the risk for you contracting a droplet transmitted disease would be very low. Okay, so if we move on to airborne transmitted diseases, this is a whole different thing, and these are the most capable infectious diseases in terms of transmission, because they develop out of droplets. How does this work? So we've just seen that droplets contain a lot of solid material, which some pathogens can connect to. And after the water that's included in the droplet evaporates, you basically have dust, you can say, infectious dust that stays. And this infectious dust, with all the air movement in a room or outside through wind, or if you even move past it or walk through a dusty area, so it gets thrown up and is traveling with the airflow. And this way it reaches, it covers a great distance, let's say it that way. So the case I was just describing, that me standing with the back to a person starting to cough, means if I have an airborne transmitted disease, I could even infect the person standing behind me. So there are records of, in case of measles, that would be an example for an airborne transmitted disease. There are records that in a hospital, in the ground floor, where a patient was just treated, a children's hospital with measles, and they had a window open, they got another infection in the same hospital 2 stories up. So there where the windows were also open. So these are very potent way of transmission. But the good message is that we are in COVID-19, we are only dealing with a droplet transmitted disease. So this is what we are going to see. So now, after we briefly discussed the 3 different modes of transmission, I want to briefly address our little pyramid, which basically gives you an overview of the 3 modes, and they are sorted first after the amount of diseases or pathogens. So basically contact transmitted diseases makes the bulk of all the diseases, builds the basis of the pyramid. Then you've got the droplet transmitted diseases, and then you have only some airborne transmitted diseases who are on the top, who are the most capable, only in terms of transmission. So then if you look at the little red arrow, that means, so an airborne transmitted disease is able to be transmitted via droplet and via contact. So if vice versa, a contact disease is not being able to be transmitted via droplet or airborne infection. So it only works from the top down. So this basically means if we compare again to our COVID-19, which is droplet transmitted, we recognize that it's not airborne transmitted, which is a good thing, but we can also transmit it via contact. So basically, if I'm coughing at a surface and somebody else touches the surface afterwards, he has the pathogen on his hands, and it's likely that he can catch an infection. Then there's also a difference that needs to be considered via transmission and infection. The transmission of germs is only that you get germs on your skin or somewhere else on your body. Most likely it's your hands. So it's well documented that is the most likely way of infection. And then infection itself means that these germs actually made it into your body. So, and how does this work? Mostly the point of entry for any germ we can contract is the mucous membranes, which includes the mouth, nose, and of course the eyes. These are the most exposed ones. And in terms of contact infections, if we talk about most diarrhea causing diseases, they are mostly associated with food in some form. And an easy way to prevent this is maybe, you all probably heard of the rules: cook it, peel it, or forget it, or washing hands. So that's a quite easy way to prevent an infection. So with droplets, it's a bit more difficult because we don't need our own hands to get near our mucous membranes. We only need the droplets, even if they have a rather short distance of travel. Good. There we go. Up ahead. So now we going a bit have a closer look on COVID-19. So the situation of COVID-19 developed from animals. So the most suspected candidate here are bats right now. That at some point the disease jumped from bats to humans, and after that it mutated the way that it was transmittable from human to human. So the problem with that is that it's not known to humans, so nobody has an immunity against this virus. So every human is very susceptible, and that causes a lot of problems. So then we talked about the transmission way, that it's transmitted via droplets and contact. The incubation period is between 0 to 14 days, and in average 5 to 6. So the patients are considered infectious over a period of 14 days in total. And there are newer tests and results who are also, if you want to look into them there, but part of it is in German, so the publication of Christian Drosten. So it would be not so easy to read for everybody, but if you want to read the report of the WHO Joint Mission, it's also linked on the WHO or WHO website. So you can see that there are indications that the infectious period from the point where you show symptoms is going up to 8 days. So this is the latest evidence we get. Good. So then there are some other points I have to point out in COVID-19. So it's also an enveloped virus, which is a kind of good point for us because what we know about enveloped viruses is that they are not so persistent to environmental influence. So, for example, we know that even household cleaning chemicals can easily destroy the virus. That makes it, from an IPC standpoint, again, very good to handle, let's say it that way. So it's easy to kill it on the outside of the patient. So disinfection, hand washing, even just regular household cleaning works to protect yourself. So that's a good thing. Then the next point is, until now, COVID-19 causes acute respiratory infections, which are mostly associated with cough and fever. That these are the most symptoms are known. So there are a lot of others or other symptoms like even diarrhea is described, but they are in far less cases. So the most cases report fever and cough, and it's leading up to severe pneumonia in some cases. But the majority of the cases we see, so about 80% of them are mild cases, do not require any medical attention. They just need to stay home and take their time. So for the other 20%, things get really more complicated. So these are severe cases who need medical attention. So, and this is a big problem. If you have a lot of patients, and this is especially seen in the severe situations we've seen in Italy right now, or for example, you can also look to New York. So there's a lot of patients, and the medical system just gets overwhelmed by it. This is why all these containment measures with people required to stay home or quarantine at home, try to avoid contact, are becoming so important. So our goal is to avoid a lot of patients coming to a hospital at the same time and overwhelming the system. So as soon as the system gets overwhelmed, we see these rising numbers of people dying. So we can't attend to every individual person like we would normally do in our medical systems. So we need to resort to, in German we call it Katastrophenmedizin. So it's basically in a catastrophic emergency, you just treat the patients where you think you can save them, and everybody else sadly didn't get the attention they would need in such a situation. So these are the points. So, and this whole strategy only can work if the whole community is supporting this strategy and coping with it. But so if the people would try not to get or let's say they would stick to the rules and distance themselves from each other, which I often hear the term social distancing. I wouldn't say it's a social distancing. It should be more like physical distancing, because people are still allowed to talk to each other if they're fine apart. So that's also a thing you need to consider if you're thinking about communities, and especially people living alone and taking care of them. There somebody needs to look after them, and contact is still possible, but you need to keep the distance. So basically what I wanted to say is that the society as a whole needs to work together to prevent this collapse in the health system. So that's the important point. Okay, everybody else was there. So currently no available treatment, vaccination. So it's only supportive measures. In the severe cases, the people will mostly use a respirator and for some time until they recover on their own. So this is very resource intensive care. Good. Then a brief note about the naming of the coronavirus, because there are a lot of different names for it out there. So basically the virus itself is called SARS-CoV-2, which basically it says that it's the second coronavirus. If you remember, we had a coronavirus some years ago, which was called SARS, which basically means severe acute respiratory syndrome. And the new coronavirus is basically SARS-2. So, and the disease it is causing is called Covid-19, coronavirus disease, and which was first seen in 2019. So now let's look closer at the transmission precautions. We already mentioned the distancing. And another point is the cough etiquette, which is very important for a medical setting. So when no masks are available, this is a point you can't stress enough. It takes a lot of discipline, I think, for the people to do it, but it's more a very effective way to do it. If you just cough in your elbow, using your hands is not so good, because we learned it's also contractable via contact. So I would use my hand to shake hands. So I should not use my hands and use my elbow to cover my nose and mouth if I need to cough, or a tissue. And the point with the tissue is it should be a single-use tissue and then go away if possible. Yeah, and then the most important point, hand hygiene. Soap and water will mostly do the trick. So it's widely available, and the majority of people, I think, is familiar with the technique of using soap and water. And the point of alcoholic hand rub, it is recommended by WHO, the German institutions, the CDC, everybody says alcohol hand rub is fine. But you also need to keep in mind there's a lot that can go wrong if you use alcohol hand rub. So we have, even in the medical field, we have regular trainings on the use of alcohol hand rub. And yeah, we still, in every training, it's performed every year. It's mandatory, at least in Germany. So in every training, you find healthcare professionals who didn't come up with the right technique to disinfect their hands. So that it can also cause a false sense of security. So that should be kept in mind if using alcohol hand rub. There are a lot of helping tools out there. If you go on the websites of the CDC or the WHO, you find instructions how to use the alcohol hand rub. So if you provide alcoholic hand rub, you should also provide these instructions how to use it, because you don't want to, give them the people a false sense of security. Good. These are the main precautions we can take. And with these precautions, outside a medical setting, a transmission could be prevented. Good. So now concerning masks, I know this is an ongoing debate. Just today in the news, when I woke up this morning, I read that there's a debate coming up in Germany also to implement the wearing of masks by the wider population. So WHO at this point doesn't recommend the use of masks widespread. So this needs a bit of explanation. So at this point, it's only recommended for medical personnel because we're facing a big shortage of masks. The whole world is jumping on protective equipment. And so the stock is getting very low. And the people who need the masks the most is the medical personnel because they have, it's in their work. So they have to get close to a patient. Everybody else who can stay at home or doesn't need to get really close to another person while dealing with them doesn't really need a mask. If he can keep his 2 meters distance, he's perfectly fine. But medical personnel needs a mask. So this is the point why we can't stress this enough. If those masks would be handed out to the wider population, the supply issues would be even worse at this point. So they are only really recommended for people who are feeling sick themselves. So they have a cold or something, which is hard to differentiate from a coronavirus infection. So it causes basically the same symptoms. And you want to be sure, in that case, you should use some kind of improvised mask, which can basically be a scarf that are put over mouth and nose, and it's only meant to protect others. Or there are a lot of instructions on preparing your own mask, like sewing a mask or something online. So this can be done, but medical masks should be preserved for the medical personnel. That's what we want to say. Good. So what else can we do? It depends wholly on your setting. You heard about the basics, how the infection would be transmitted. So there's a lot of things. First of all, it's providing information, giving information to the people you're dealing with. So hang up signs to promote cough etiquette and hand hygiene. But if you hang up a sign and promote hand hygiene, you should also consider to providing water and soap that the people can actually provide their hand hygiene. Then reorganizing waiting areas, waiting queues, regular environmental cleaning, or if you already implemented regular cleaning, that you do it more often. And for example, I saw it in a supermarket. From my point of view, it's a very elegant measure to protect the cashier working at the supermarket. Just a protective shield, or a piece of glass that separates the people. So you don't have this ballistic trajectory, so it's interrupted, so the cashier is safe. And there's a lot more to think of. It all depends on the setting. So I guess that's so far from my part. I would be open for questions. So there are 4 websites I can recommend. That's one, the website of WHO to get information, and the website of the American CDC. And especially the CDC is very important, or a very good website, because you directly on the front page you get information how can I protect myself from COVID-19 and recommendations how you can organize your household and how you have to wash and clean. It's just very good setup. These are things that are far more lacking on the German side from rki.de and the ECDC. So they contain also some specific, or let's say, information for professionals who can be distracted, but the CDC side especially has some very good information.
Thank you very much, Hendrik, for your input. I think especially the last page was very useful for the participants with the ideas how to deal with the disease in their projects. Maybe we can get more ideas at the end of the webinar when the participants share their ideas. So if you have questions now regarding the medical basics, regarding infection prevention on the presentation, please feel free to ask your questions by using the chat box. I have already received one question that says, if there's a person who is infected but that doesn't show symptoms, does the 14 days quarantine really work? Or can the person still be infected afterwards because the person doesn't know that he or she has the disease? How to handle this situation?
Yeah, okay. So basically, we count this 14 days period from the day 0 is the day when he starts to show symptoms, because beforehand we can't know that he's infected. So basically, when he is contracting symptoms, from this point, 14 days after that, he's not infectious anymore. So we already see that he probably is not infectious after 8 days anymore, after the beginning of the symptoms. So after 14 days, he should be pretty safe that he's not infectious anymore.
Okay, thanks a lot. One more question that came up is, what is your opinion about spraying the disinfectant for your body, such as spraying some medicals on your body to prevent spreading the disease?
So basically, no, this doesn't make any sense. Just take a shower like you would normally do. It's totally doing the thing. It doesn't give you any benefit. So it's very unlikely that you get with your knee close to your mucous membranes. The most important part are your hands. If you keep your hands clean, you're pretty safe. So it doesn't make any sense to shower in disinfectant or something like that. I wouldn't recommend it.
Okay, thanks a lot. Yeah, I mean, you just in your presentation, you also mentioned the social or physical distancing, which
Yes.
is also very important. Okay, I suggest to go over to our second input now. In case you have more questions also for Hendrik, please feel free to use the chat box to write down your questions. But for now, I would like to ask Melly to tell us about your experiences and project adaptations in Indonesia.
Okay, thank you, Caroline. And I'm pleased to be able to share our experiences here in ISP Indonesia, and to also later maybe I can learn from you on how you adjust your operations during this COVID-19 outbreak. Okay, so before sharing the project adaptation in Indonesia during the COVID-19 outbreak, I would like to share a bit of background of ISB operations in Indonesia. So ISB works in Indonesia since 2006 following Yogyakarta earthquake, and the office has been managing some projects in the Philippines remotely through local partners since 2014 following the Typhoon Haiyan. We work in Indonesia and the Philippines for disaster risk reductions, humanitarian response, climate change adaptations, and socio-economic development sector, with the emphasis on social inclusion and disability inclusion in particular. In Indonesia, we have 3 offices, one main office in Yogyakarta, and 2 field offices in East Nusa Tenggara, and one other office in Central Sulawesi. The Central Sulawesi office is newly established following the recent devastating earthquake, tsunami, and liquefaction in the area. In the office, we have emergency response team, or ERT, and one of the ERT divisions is monitoring and alert team. The team is in charge for disaster and emergency situations monitoring, and also responsible to provide update and recommendations to country director to respond to emergency or crisis situations, including during this COVID-19 outbreak. Adjustments to ISB operations, including for project implementation during the situations, were made through consultations with the ERT and management meeting accordingly. To date in Indonesia, there is no strict restrictions on movement, quarantine, or lockdown policies from the national government. But as the government is still considering further socioeconomic impact from such policies, and now they are assessing the mitigations of the impact. But in the local level, the response is quite diverse since the development and impact of COVID-19 at local level, including in our working areas, are at different stages as well. Since the mid of March, we have applied work from home regulations. At that time, there was no COVID-19 case confirmation in all ICE-based working areas. However, we prevailed the work from home regulation earlier to respect the social distancing recommendation from the national government and for staff to be more prepared in case a strict regulation would be out later. The regulations, the work from home regulation prevails earlier to also signal to staff that the office puts staff safety, security, and well-being as the priority in the circumstances, and to allow staff to be more attentive on the situation and start taking necessary personal or family preparedness measures in advance. I think it's similar with other organizations. We developed and applied general guidance regulating no business travel, local and domestic, no large gatherings, limitations of direct contact among staffs and between staff with stakeholders and communities, and also encouragement and provision of support for remote communications and coordination. And the situations, I think it is important for the team to still feel connected as a team. So we hold a weekly update through informal online meeting where staff can share situations in their living areas, challenges they face during work from home, and if they need specific support from the office. We also applied internal communication protocol regarding COVID-19 among the team to avoid staffs being overwhelmed with too much information, which can lead to unnecessary panic and confusions. So in this case, the ERT is in charge for information screening, both from internal and external sources. Actually, some of post-disaster recovery activities in our Sulawesi office, such as for construction activities, is still continued to date, considering that the activities include cash for work mechanism for communities, and we consider that the postponement of the activities would affect the community income. So we decided to continue the activities with some considerable measure for COVID-19 preparedness and prevention. The activities is conducted through close coordination and consultation with local authorities, and we also considering and installed appropriate personal safety and hygiene facilities in the office and in the construction sites. The team installed facilities for staffs and community constructions worker to practice basic personal hygiene. Safety and security briefing in the beginning of daily activities to also include COVID-19 safety messages as well. I think close communication and consultations should be done together with the community in these situations, and also with village government and relevant government stakeholders in the working areas, in particular regarding the changes of IS-based working mechanisms, any cancellation, as well as postponement of ISB working activities. This is besides to maintain engagement, the communication approach is also made to prevent unnecessary panic and confusion. For sure, like other organizations, we anticipate delay of project implementation due to the mentioned arrangements. We clearly communicate to the team not to worry about the project not meeting the planned targets, since these crisis situations happen almost everywhere in the world, that project partners and stakeholders as well as donor might anticipate activities delay anyway. However, we require a frequent update from the field or from the team to fit the office communication with headquarters and also with donor regarding activities adjustment and or potential delays. We also reach our partners in the Philippines to learn from them the situation in their working areas and the impact of the situations to the project implementation, as well as to learn whether they have proposal for activities adjustment. I think during this COVID-19 outbreak, communication and connectedness are the main challenges. So we try as much as possible through line managers and human resource manager to do head count, monitor staff movement, conduct more regular staff check. This is to learn their and their family situations, how they feel, what kind of flexibility they need to cope better with the current situation, etc. We make it clear in every communication for staff not to worry about the work, as we can always agree on adjustment and communicate to relevant parties. So we make it clear that priority is on staff's security, safety, and well-being. Because I think in this situation we cannot come out with one-fits-all solution anyway due to the fast development of COVID-19 outbreak. Therefore, we rely on the team assessment and trust them to apply necessary adjustments. So the office will only observe and assess whether the proposed adjustment has considered safety and security for staffs, beneficiaries, and stakeholders, and how we can improve those safety and security aspects. In terms of external response, within the scope of our core works and projects, we contribute to the availability or to the provisions of accessible and actionable inclusive education communication materials. In this case, we develop and disseminated IEC materials in consultation with network of organizations of persons with disabilities. Persons with disabilities and also older person will be our main targets in these initiatives, because they are more likely left behind in the COVID-19 risk communication for various social environment factors, and as they have different needs and capacities. We also plan, in terms of external response, we also plan to conduct conventional outreach involving limited direct contact in collaborations with organizations of persons with disabilities and frontliners such as community leaders and community health workers, because we consider that many of our community beneficiaries are having limited capacities in accessing and understanding formal and online communications. Distributions of personal hygiene such as hand wash soap and hand sanitizers is also planned as a practical stimulus for communities to start practicing basic personal hygiene. The stimulus is still necessary, because some personal hygiene messages that might be practical for us, not necessarily practical for communities due to different priorities and also different perceived hygiene behavior. Further, in terms of coordinations with other stakeholders, we intensively involve in government and CSO coordination meetings or webinars to see how we can contribute on the response and how we can influence more inclusive COVID-19 response. So we can say that reduced external regular activities not only affected by our internal operation adjustments, but also by our intensive involvement in COVID-19 external response. So to conclude, I can say that during the COVID-19 outbreak, we focus more, our operation focus more on maintaining staff safety, security, and well-being. And emphasizing internal activities while still continue doing external activities that can be managed or coordinated remotely, as well as prioritize communities activities, which include cash for works, and also contribute to the government and community preparedness and response to COVID-19. I think that would be it from me. Over to you, Caroline. Thank you.
Thank you very much, Melly, for your input and your insights into your work. I think we're all facing the difficulties that come up with communication and connectedness. So I would go over to the second round of Q&A now. If you have questions on Melly's input, please also write down your questions in the chat box. First, I would come back to Hendrik's input because several more questions came up on the first input. While we're answering the questions, please write down your questions on the second input. So Hendrik, there were two questions on the infection of objects. So when an object is infected with the virus, how long does it remain infectious, and is it a risk? Is it a risk to persons? And if we buy clean vegetables, which we buy from the market or supermarket, do we have to wash them with soap water?
So the first question was about if you buy vegetables, if you can, you need to wash them with soap water. So not necessarily. So it depends what you do. If you peel your vegetables and consume them afterwards, totally fine. So you just need to wash them with water. The main way of contracting is really the personal contact and getting directly infected with the droplets. So the second way, we talked about the contact, and in this case, the contact to vegetables. So if we look at the data we have right now, of the most cases who were investigated, and this is a big study from China, most cases where the disease were contracted had nothing to do with objects. It was always the close personal contact. We're just anticipating that there could be a contamination of objects because we know of the properties of the virus itself. So, but there are no documented cases. I would take the risk of getting infected via a contaminated apple or eating such an apple at a high priority. Just wash it, treat it like you would do it regularly, wash it with water, peel it, and then you should be fine. And of course, wash your hands before eating. That would be the answer to that question. And the other question was also related to objects. Can you please repeat it, the first one?
Yes, the other question was about objects. Do they remain infectious, and is it a risk for people?
So, yeah, like I said before, it could pose a threat. So there are different, there's also a discussion. It's not completely clear. So right now, the agreement is that it can live up to 48 hours, the virus, but it depends very much on how the environment in this situation is. So if there's direct sunlight at a spot or something, there's a lot of influence in these things. So you can't give an actual number. But if you want to go with one, that it's 48 hours. So just if you suspect a surface to be contaminated, I would just recommend cleaning it with just basic, if it's the easiest available, just household cleaning chemicals.
One more question about the incubation period again. If a person does not show symptoms but might be infected because she had contact with another confirmed infected person, how long should this person stay quarantined?
So the recommendations right now, then, if he feels that he was in contact with a person, or he knows that he was in contact with a person, also 14 days period. if we look at the median, if he really caught the infection in his contact, after 2 to 5 days, he should show symptoms, and then it's a whole different thing. So then the whole period of quarantine starts again. So if I think I'm infected or I had a contact, I should stay at home 14 days. So, and if I show symptoms at 1 day, then I would start again from that point with my 14 days to be sure.
Okay, and how do we know a person is cured? Is the person tested again?
Yeah, they are tested several times if they are in treatment. So, but all these tests showed that after a period, like the newer data says, after 8 days, it's showing symptoms, they are not infectious anymore. So that's where the indication goes. So all these numbers with 0 to 14 days. They're also from the beginning of our pandemic, where we had very little data available, and so they took this period to be really sure that everybody gets in there.
All right. And what about greetings? One person writes, they have been told to greet with the elbows, but and not to shake hands, but we've also heard that we should sneeze into our elbows. Like, what can we do? Is the best way to prevent any forms of greetings, or what would you recommend?
Yes, that's what we would recommend. Just, I know it's also a cultural thing, if this is possible, but if it is possible, I would completely let those greetings out and just stick to saying hello, and avoid the contact at all. That would be the recommendation.
Yes. And one other question from South Africa, which says, we are currently in a 21-day lockdown in South Africa. However, a large part of our population lives in informal settlements, like densely populated areas, making a lockdown and physical distancing difficult. Like, many people use communal toilets and taps. Do you have any suggestions or best practices for how people could protect themselves in such a situation?
Yeah, that's a very difficult situation. So at least people who are belonging to one household. So that's basically what we're doing here too. So a family living together, so this group is allowed to stay together, and they should, the whole group should avoid contact to, let's say, the neighbors, which would make up the other group. If the living conditions are that bad, that's difficult to answer. So the basic principle still stays the same. So if you can't get them to separate in some form, or at least take out the ones who are infected, if you can, or the people who show symptoms, and separate them from the rest of the group, that would be a possibility. But we're talking of a lot of people here, and if such an infection it's in a close environment, it's easily transmitted. I don't have a general solution for that problem. So it really needs to be decided on the basis. If you on the side think about how we can achieve it here in the community, and that needs to so we need people to go out there into the community and look at the spaces and give advice. That would be my consideration there. So implementing a lockdown in such a thing is difficult, and even how do you uphold this lockdown if the people don't cooperate? This is also another point to consider.
Thank you for your answer. So I have 2 more questions before we go over to questions for Melly. Those last 2 questions are, is it true that the virus dies above 23 degrees? Because people have heard that the pandemic will come to an end because of higher temperatures. And the other one is it true that it comes from birds, and can Can you say something about this? How can we know where the virus comes from?
Okay, so the virus. So the source of the virus was in the city of Wuhan, and it was on a market where animals were sold. There we are pretty sure. They are not really sure about which animal it was. So the hints are that it's bats, that they are the source, but it's not finally clear. So they're still looking into it. So this is the source, and something like this happens a lot of times before. So there are a lot of examples for diseases who normally contracted from basically zoonotic diseases, so disease from animals jumping over to humans. So this is a well documented topic. So not the first, which makes the coronavirus very special in that regard. There was the assumption, because normally you have in these respiratory tract infections there are a lot of these infections in the winter times, and as soon as the spring comes and temperatures get warmer, so these diseases shift a bit, and so you have less cases of these diseases and more other diseases. This is normally true, but the point here is, if we see now, we have also countries who are in outbreaks in countries who are in tropical conditions with higher temperatures, and the virus survives. So we don't think that the changing in temperatures will really improve the situation in this case. So I fear that you can't say that if you have a temperature over 23 degrees, the virus is not a problem anymore. No, I wouldn't agree.
Okay, thank you very much. So still being careful also in higher temperatures.
Yes.
So I would like to go over to you, Melly, again. There was one question arriving for you. What kind of gatherings do you still hold? How many participants? And what kind of measures do you undertake to avoid transmission? And what kind of communication measures do you use exactly to avoid overwhelming and panic among staff?
Yeah, thank you, Caroline. So for the large gathering, we limit it to 10 persons, as suggested, as recommended by the local government. 10 persons, I mean. And also because this is like a construction works, and it's about constructions for water system. So we manage that the distance the worker really making appropriate distance to avoid transmissions. So for the prevent transmissions, the safety measures we conduct is to install, as I mentioned in the beginning of every activities involving limited persons in the gatherings, we begin it with safety security and include it with the safety messages regarding COVID-19, and also we provide the worker with a personal protective equipments, and we also install facilities like I mentioned, especially for the hand washing practices in the construction sites and also in our office. Yeah. That was and also we put like everywhere reminder like posters in the construction sites regarding personal hygiene practices, and also we locate our WAS experts to monitor and limit interactions between workers. Yeah. And for the communication measures to avoid staffs being overwhelmed with the informations, so we have a WhatsApp groups, and then we treat the WhatsApp group as one of the reliable sources of communication for the staffs or for the team during this COVID outbreak 19. And we also know that there is a huge excitement from individual staffs to share information that they get and to post it in the groups, but then we we have applied protocols. So for every individual that would like to post some specific informations or would like to share specific information to the team, they need to share it first to our ERT, to the monitoring and alert team, and that the ERT will screen whether it is necessary to share it to the larger group of the team. I hope it answers your questions.
Yes, thank you very much, Melly. Now we have several questions for Hendrik coming up again. I think the questions on the medical basics are very important at the moment. So, Hendrik, I would like to ask you 2 more questions before we go over to the third part. Hendrik, the first question is, can someone still transfer the virus after he or she is cured? And the second question is there any established technical protocol for IPC program to protect staff that are involved in the COVID-19 response?
So the first question. So after a person is cured, it's generally they're not infectious anymore. The only point regarding this, after they went through the infection, there's the question if they can contract it again. Basically, what about their immunity? So this question is not answered. There's a wide variety of, so it mostly depends on the national policy. So even the German policy, and Germany is also very federal organized. So even the different states inside of Germany, the protocols vary a bit. It depends on the IPC stuff on site. So the principles are the same that are applied, and a very good source of this is the WHO, who gives you the information on the principles you need to apply, and then you need to look up at the specifics of your site and even what it's considered to your material that you can use, how the setups of your rooms are. So this is very different in a lot of places. So I don't know yet of a general strategy plan. So that there are a lot out there, and they differ.
Okay, thank you very much for your answer, Hendrik. Thank you for all your questions as well. I'm sorry for not being able to answer all of them now, but as we have another part in our webinar, I would like to go over to the last part now. Melly has just shared some examples from her project work, and now I would like to ask you to share your experiences and your ideas how to integrate prevention measures into your work, or maybe you have made some experiences how you adjusted your projects. Maybe there are already some aspects that were helpful for your work and that you would like to share with the colleagues here. So now I would ask you to write down your experiences in the chat box. I will read a few of them here, of course, anonymously as well. And all the statements from you that we are collecting now will also be included in the email that you will receive after the webinar. So you will receive a collection of good practices from all the other participants. So please take your time to write down what you would like to share now. To begin, I have received 2 messages on this. One participant has 2 questions that maybe you have an answer on. One is, in Zambia, schools are closed indefinitely due to COVID-19. Longer school closures increase the risk of dropout for girls. What experiences do the participants from the local partner organizations have to prevent this? So if you have experiences on this question, please feel free to write down your experiences as well. Another one is on the impression that especially in countries where Ebola crisis has occurred, or also neighboring countries, the fear of COVID-19 is very great. So Ebola has left a trauma in society. Is it therefore very difficult to explain differences to take away fears? What is the experience of others? Has anyone developed a good method to meet these fears? So if you would like to answer those two questions or have other recommendations for the participants, also maybe you've taken up some measures Hendrik has already mentioned in his presentation, like waiting areas, please feel free to write down everything that you would like to share with all the other participants. While you are writing, I would like to thank Melly and Hendrik for your great inputs. I think your presentations were very helpful, and I guess that all of us can take a few aspects from your presentations for our work. So thank you very much for your inputs. I have already received a few statements from you. One is there was a task force established in their projects and refugee camps and health centers, and hygiene methods are used in all the offices, like alcohol or sanitizer, and some staff is also relieved from work. Another participant writes, IEC materials are collected and distributed. So thank you very much for your measures. So thank you very much again to all of you for taking your time for answering your questions. Thank you, Melly and Hendrik. Please take care of yourselves. Thank you a lot. Hope to see you next time. Goodbye.
Goodbye. Thank you, Caroline.
Goodbye.
Bye-bye.
Thank you.
Thank you.